Hey, this is Tricia here from Devoted Healthcare Consultants. Hope everybody out there is doing well on YouTube world. First of all, I'd like to say if you can like and subscribe down below and hit the notification bell for any time that I post a video, you'll get notified. Just reaching out to you guys today because I wanted to just do some teaching in reference to when you are meeting with your client and client family for the first time and you're trying to get the potential client on board with your company. What you would want to do is to ask a few questions of the family or of the potential client to find out what it is that they are looking for. So first of all, I have my notes here, so that's why I wrote some things down. So I'm going to be referencing my notes. So first of all, you want to know how many hours they're looking for. How often do they want your client to have services through your company? Will you be providing your aid to assist them with whatever they need to be done at their home? So you're asking them how many hours do they need. If it's 4 hours, usually most companies don't provide services for less than 4 hours. Sometimes they may do 2, but think about it. With gas prices right now and everything, why would you want your caregiver to go out, drive however far to go to one client for just 2 hours? So at least 4 hours is what you would want to, sign them up for. Now you want to know what is it that your caregiver is going to be doing for the client. So your questions would be, well, can that client, potential client, can they walk? Are they able to walk? Would you be needing to assist them with walking? Do they use assistive devices like a walker? Or do they use a wheelchair? Are they in a wheelchair? Also, if someone's reaching out to me, I'm sorry. Also, you want to know if they are incontinent. So incontinence is if someone knows if they have to go to the bathroom or not. If they urinate on themselves, if they have a bowel movement, do they use an adult brief? And they're private questions, but this is real life. So your goal is that you're providing services to a client that may need assistance with ADLs. That's what this whole business is mostly about. So you want to know, do you need to assist with toileting? Do you need to change a brief? Is that person continent? They may still be continent and just has issues with their memory, and they just need supervision. So these questions are going to help you or your nurse that goes out to formulate the care plan for that client. Okay? Do they need medication reminders? Now, as caregivers in the home, most times under non-medical home care, the CNA or the caregiver is not allowed to give medications to a client. They can hand them a glass of water or juice or Ensure, whatever it is they're drinking, to take the medications, but they cannot put the medications to the client's mouth and have them drink it, because that could be a liability. Okay, they're not trained for that. Another thing is, can they dress themselves? You may just need to hand them, take out the clothes, take out the socks, lay them out, and they can dress themselves. Or you may have to actually put the clothes on them, because a lot of clients may have had a stroke, could be paralyzed or so on, but they still need assistance with dressing. So you may either have to fully dress them, or you may just have to do some kind of assistance or laying out the clothing for them. So those are just a few things. There are other questions that need to be asked so you can formulate a proper care plan for the client. But that is a start. And I hope that has helped someone out there. If you are needing assistance with any of, setting up your business and so on, reach out to me. My information is down below. If you click on the little arrow below, it drops down and it opens up a listing with all my information. If you want to reach out to me, feel free to do that. You can do a consultation with me and I can help you to get on your way. Again, please like and subscribe if you enjoyed this this video, if you feel it has helped you some, and hit the notification bell as well, so when I post any more videos, you will be notified. You take care out there. Good luck with everything, and I hope to hear from you soon if you're needing my help. God bless. Bye-bye.